So how does Medicare work? This video has basic generalized information about Medicare. I'm not going to cover all the details or the specifics of the program, just really give you generalized information. So Medicare is a government-sponsored health insurance program that covers most visits to the hospital as well as visits to the doctor. Most people become eligible for Medicare when they turn 65, although there are exceptions. Basic Medicare coverage is typically referred to as Original Medicare, and it breaks down into two parts. Medicare Part A, which helps you pay for the hospital, and Medicare Part B, which helps you pay for visits to the doctor when you're not in the hospital. Monthly Medicare costs break down like this. Part A is usually no cost to most people, and Part B costs right around $100 as well for most people. Medicare has deductibles, and the Medicare deductibles break down like this. Part A has a deductible of about $1,200, and it can be applied each time you're admitted to the hospital unless you're readmitted for the same illness within a given time frame, usually about 60 days. Part B has a $147 deductible that resets once a year. How is Medicare cost sharing broken down? Part A has co-insurance, which is a form of cost sharing when you're hospitalized for an extended period of time, usually longer than 60 days. Part B has co-insurance, a form of cost sharing as well, of 20% for most services, which means you'll pay 20% of the approved costs. Another Medicare cost to be aware of relates to Medicare's approved rate. In most instances, Medicare has an approved rate, which is essentially the same rate Medicare is willing to pay for any given service, like a doctor visit or an MRI. Some healthcare providers, doctors as well as hospitals, may wish to charge more than the Medicare approved rate for services. And if you visit one of those providers, you may be asked to make up the differences in costs.